Hi everybody, my name is Precious Angie. You can call me Pishu, that's my friend called me anyways. Guess who's an RN? Guess who's a BSN RN? That's me. I took my Nclex on Monday and I passed. I'm just doing this video because most of my friends are like, what did you use? What happened? How you just came to the United States? Because I came to the United States, it's been like a year and something. And they're like, you just came, how did you make it? Did you go to nursing school here? Where I'm like, nope. I graduated from St. Louis is Cameroon, Africa, and I came out with my bachelor's degree. Yeah, so it was really quite easy. It was really an easy. This was actually my very third time. People don't know it, yeah. Most of my friends thought I took the NCLEX twice. To me, I believe that when you fail the NCLEX, right, you do not have the right pattern. You do not know how to study. You do not have anybody that can guide you. So you end up using a lot of resources. You end up studying a bunch of things that do not really make sense, and you get confused. I will highly recommend Achar Review. Achar is the best resources according to me and my friends who used it and passed. We all use Achar. The short pass combo is definitely the best. You could go. I would also recommend UWorld. Yeah. This time around, I didn't use UWorld in my first attempt. I didn't use Achar in my first attempt. In my second attempt, I didn't use Achar, but I didn't know how to use it. I didn't know how to use it. So this goes to international nurses. We do not study in the United States. We do not know this is like multiple sclerosis. We do not know this is like Guillain-Barré syndrome. We do not know this is like myasthenia gravis. We don't know a lot of those diseases because we don't have them in our country. And yeah, so you need to study from afresh. You need lectures. You need to know what those diseases are. Even diabetes. I'm true to be told, I learned my diabetes in this country. Yes, I knew what diabetes was, but the different type of diabetes and how to, to differentiate. That's it. So you need to get lectures. You say, oh, I don't want to. I'm listening to it too as lecture is too boring. I can. You have to do it. I said you don't want to pass your exam. You have to do it. So listening to those lectures are very important. That's why I say actually to me actually is the best because first of all, the on-demand lectures are unlimited as compared to other resources. Other resources you'll see a whole system for 4 or 5 hours, which I understand that's lengthy. Which Asha has everything when it comes to. They're just really good. Those guys are the baddest. They're just really nice. So that's what everybody thinks about me. They'll be like, "What do you use? What do you use?" I'm like, "I use Archer." They're like, "Are you sure you use Archer?" I said, "Yes, I did use Archer," and they're very nice. Then for the question for your Q bank, I would say use UWorld. Use UWorld when maybe you're done with your lectures. You've used Archer, and you're left maybe like a month to your exams. I'm saying this especially to my international colleagues, parents, or nurses. Yes, you know what I mean. So because the way you work is, because to me, I feel like that's the hardest Q bank. It's really hard. Yeah, it's really hard. That's the way the NCLEX is. It's hard. It's so tricky. You have to have a lot of critical thinking because you can know content and don't have critical thinking. Yep. Absolutely. You can know content and you do not have critical thinking. And if you don't have critical thinking, you fail. Take it from me. Run the NCLEX 3 times. Yep. So the first time, I didn't know the content well. I didn't have critical thinking. I failed, and I failed at 85. So those of you who say I passed at 85, that's very good. So don't get blindfolded by people who say when your computer shut down at 85 it means you have passed. It doesn't mean you have passed, baby. It could either mean you have passed really well or you have failed really well. Because the computer is like, hey, you know too much. Or hey, sorry, you can't do this. We'll go back to school. So yeah, the second time it took me up to 150. I almost nearly passed, but I didn't. So for you to pass the NCLEX, so when each time when you fail the NCLEX, right, they give you like how do I call it? Some sort of review on how you did, the things the section you're supposed to pay more focus to. I think they're like about, I don't know, maybe 10. I can't really recall. So you need to pass every section in order to, pass the NCLEX. And I had like on a scale of 10, I think it's like 10 sections if I'm not mistaken. I think I like 8 of them or 7. So you see I almost passed, but I didn't. I was like, okay, that's fine. We're gonna work on the rest. And the second time, my computer shut down at 110. It did shut at 110, and I did very well. I know I did very well because when I wrote the exam this time around, I first of all, because I used the U word. When I tell you word, it's hard. It's hard. The very first time I took the U word, like a ready assessment on U word, I had 55%. I was like, Jesus, I was like 55. I'm like, okay, let's go through it and the rationale and see what was missing. And I was like, please pay attention when you fail a question. Even if you pass a question, make sure you do the rationales. Like, make sure you go through the rationale. Why this was correct, why this was wrong, why did just go through it, because it's gonna help you. When I tell you, you will help me in my English this time around. The rationales. It's not like the questions came like the way it was on you will know. But the rationales, the understanding that I had and I got, it helped me in the Nclex. And I'm very, very happy. And that's why I tell people, use these two resources, yes. Use the Acha for your lectures, do the questions there, because I saw some, I can say like, I saw some of the topics that I went through the Cuban in Acha. Yeah, it did come in my Nclex, and I'll tell you, use Acha and use your word. It's 100%. That's what, if anybody tell me what do you use, that's what I'll tell. And also use Rema Quick Facts. That's one of the resources that helped me with my pharmacology. When I tell you I was 0 and 10 when it came to pharm, I didn't even know what beta book I was. So that's how bad I was. I didn't know hypertensive drugs and stuff like that. But yeah, but now if you wake me up and now what is this? I'm gonna tell you. I'm gonna tell you. So use, if you can get Rema Quick Facts. I will see if I can pull up the link on TikTok. It's not even I think it's like $20 or $25 for the textbook. It's really good. The back section of it, it's superb. Her pharmacologist, it's well summarized. And of course, your Martin McClement. Marquet is very good, but I would say, like my friend told me, Teresh, just like, use Marquet the last week of studies, use Marquet the last week, and of course, use Marquet in your last week of studying for your Nclex, because if you trying to use it during the first week or the second week when you study, earlier, you might have a tendency of not going through your lectures, your on-demand lectures, and you don't miss a lot. So give my kid like a summary, a summary you're trying to go through in lectures or something, and it's very helpful. Trust me, use my kid lectures and your critical thinking. So since I did lack critical thinking the second time I was waiting for the Nclex, I bumped into actually one of my sisters gave me this link. What's it called? It's a Latino man. I will try as much as I can to label up his name, his YouTube page. He did I think was it 7 days Nclex review critical thinking, and trust me when I tell you it helped me, it did help me with my critical thinking, because there's some questions that all of the answers are correct, but the one the most correct, like the very most correct, or the one the first thing you need to do, and you get confused because you know everything is correct but you don't know what to pick, and that really gets confusing. So yeah, I think that's all. So I use Achar, I use Uward, I use McClemens, I use Rema the Quick Fact. You could use the V2 too, which is good, but I didn't use the V2, I used it because I already had Achar, so I used the Quick Fact. And the guy, the Latino man I'm trying to remember, I can't remember, but I'm gonna find his name and put it up for you guys. So yeah, basically I hope this video finds somebody. I hope this video helps someone who is giving up. I'm just here to tell you that please do not give up. I know it's very draining. I haven't actually come across any video on TikTok that talks about how Nclex is very hard and how demanding it needs for you to prepare for it. Like, I was a mess for this couple of months. I studied for like, I've been going back and forth for this Nclex for like 7 months. Took it 3 times within 7 months, and trust me, it wasn't an easy process. But I'm so happy that I finally passed my Nclex. So yeah. So if you've written Nclex once, twice, 4 times, 5 times, 10 times, I'm just here to tell you that do not lose hope. Keep trying. Maybe there's something you're not doing right. Maybe you're not studying the right way. Maybe you're not using the right resources. Maybe you're working. Maybe you're overwhelmed. Maybe you're stressed out. Try to cut off the things you know that are stressing you out, or try to reach out to people. Reach out. Anybody, you can reach out to me if you need help. Reach out to people. I cannot count the amount of strangers I reach out to. Just ask, hey, please, what resource do you use? What resource do you think this one is good? Do you think it's nice? And always work with your instincts, because at the end of the day, because what might work for you might not work for me. What might work for me might not work for you. Everybody's just really, really different. But try as much as you can to make sure that you get the best resources out there. For real, we're all going through life. Life is very hard on its own, so I can't even imagine you doing this Nclex preparation and trying to deal with life at the same time. So it's really, really hard. I understand. but take it one day at a time. You know, try as much as you can to strategize people you like together, and you know, make sure you find a study buddy, anything that's going to help you, that's going to motivate you to study. Oh, I did forget, I knew I was forgetting something. Nclex high heel, I don't know how it escaped my mind. So the Nclex high heel, Dr. Z, he's the baddest. So I know his program is kind of expensive. He has a free Zoom live session every Wednesday, which is very very nice. Nclex high heel doesn't have a keybank, so you use it too. So it's very nice, 100%. Even though it's kind of expensive, I know the program is expensive, but it's really really nice. If you have your money, you know, you can finance it, and that's very nice. I recommend that too, highly recommended. Dr. Z does a very nice job. He and his team, they really break down like the lecture. They are very nice. When I tell you, how do I explain this? If there's a topic you're finding it hard to understand, and maybe they do that because they always have like a free live session every Wednesday, 1 hour. They always go like through a topic, and they always take like questions at the end of the topic, which is very nice, very very nice. I attended those. I think those were one of the things that really helped me before I took my exam third time. I attended about 5 live sessions, and trust me, it was really nice. It really changed my life in some kind of way. So yeah, that's a very nice resource to use. So I hope I've helped somebody. Share this video to somebody who knows somebody, or somebody you know who somebody. Always preparing for the Nclex, always aspiring to take the Nclex someday. Some people are scared to book their day to go take. Trust me, you can't book if you don't book. At the end of the day, you need to take this Nclex. Yeah, you still need to take it, because if you don't take it and pass, you will not work as a nurse in the United States of America. So it's your choice. Bye.